Hello and welcome to episode 81 of Tom's Hirschsprung's podcast. I am delighted to be joined by Amy Parker, all the way from China, so we're going to hope the connection holds. We've got a slightly different Hirschsprung story today, and I am fascinated to know the ins and outs of how this all came to be. Welcome, Amy.
Thank you. I also hope the connection holds up.
Yes, it should do. I think we'll be good. We'll be all right.
Yeah,
I'll be able to hear you if nothing else.
no problem.
Now I know we were talking a little bit before about your daughter's Hirschsprungs, and as I said in the intro, it's not a textbook case as you told me. This isn't a not that Hirschsprungs is a particularly textbook condition, but it's not a common one, and there's certainly some things in here that I haven't heard before.
Mhm.
And I guess we'll start from wherever you'd like to start from.
From the beginning, I suppose.
Yeah.
Yeah, so we had her diagnosis in April of last year. She was almost 14 months when we had her diagnosis, but it sort of started around 6.5 months-ish. As she started solid foods, she became chronically constipated. Until then, she passed stool without any issues. So we just briefly spoke about the five things of more common in boys than girls, um, the low birth weight, sicky baby, irritable baby, and the constipation. She had none of those things, except for the constipation after she started solids. So we started to notice that she wasn't drinking as much milk, as much breast milk. She was only breastfed, but pumped milk. So we could see how much she was actually. I'm very type A. I didn't want to breastfeed, but I wanted her to have breast milk and I wanted to see how much milk she was having. I was very type A before she was even born. I decided that's what I was going to do. Some people are like, oh, my breastfeeding journey ended up in pumping. I was like, my breastfeeding journey is pumping. And that's that. I said, I don't know how much she's drinking. I need to know. So that was how I did it, right? So anyway, we started noticing she was refusing. Actually, no, a little bit before that. Now I think back, she was refusing bottles a bit around like 4 to 5 months. She was a bit irritable, not drinking as much, but that was always put down to teething. Um, and that was that. But she would still drink enough, right? It might be that she wasn't following the same sort of pattern as she was the day before or something like that. But overall, she was still gaining weight. She wasn't losing any weight, so it wasn't an issue. Then when we started solids with her, obviously they don't really take much in the first couple of weeks, even month, 2 months. They're just eating tiny, tiny bits here and there. But she loved porridge. So she would have her porridge. So she'd have her morning bottle, and then she'd have her porridge a couple of hours later. And then she'd started to maybe not have the third bottle or maybe just drink 10, 15 mils. And then the same the rest of the day. And it was like, why is this child so full? So then we started giving her like a little bit less of the porridge because obviously at that age they don't need the food as much. They still concentrate more on the breast milk for the nutrients and whatnot. So anyway, around 6.5 months-ish, I noticed like her poo habits had changed. As you do when you're a first-time mum to a 6-month-old, your life is around there pooing and peeing and drinking milk. And I had an app that I was also obsessed with. And actually, until she was 2 years of age, literally the day she was two, I put in every nappy, poo, pee, every milliliter of milk, every sleep and wake window, and every pump.
Wow.
So it was actually really good when it came to the diagnosis and following things because I had a record of everything,
Yeah.
right? But around 6.5 months, it was the August time. So yeah, she was 6 months, the 11th of August. It was towards the end of August. She hadn't gone for a week, like a full week. And now she was a bit irritable. She was trying to push and it just nothing was happening. until a Sunday afternoon. I remember it vividly. She was waking up from a nap. We were ready to go out for lunch. We were going to meet some friends for lunch. And this baby just cried. Like she was screaming. And I was like, what's going on? What's going on? And then we're like, right, check. Is she like trying to poo? Because it's been a week, right? So we had been told by a midwife friend of ours, like, put some Vaseline around her bum, try and help it come out. So we tried to do that. And you could see like it was trying to come.
Hmm.
Um, and we like took her nappy off. We were like moving her legs, tried bicycle a bit, rub her belly, tried to put her in the bath. And then this poo just came, like whether she wanted it to or not. But it came with force. So you can imagine now what was the scene in that area, and we went straight to the hospital. Um, I don't know. I didn't panic because I was more like, I know why she's crying. Like if she'd still been crying and nothing had come out, I think I would have been a bit more panicky. Whereas I'm like, she's very sore because of what has just happened. This is why this baby's crying, right?
Yeah.
So we got to the hospital Sunday afternoon. We're like, oh, is there going to be a ped on call? Because that's the way the system is there. We went, it was a private hospital, but usually on a Sunday, you might not see a ped, you might see a GP, right? Whoever's on call at the time. Luckily, it was a pediatrician was on call as the GP that day type thing.
Yeah.
Um, so we saw him and he was like, look, let me see your notes, whatever. And I'm like, literally, there's no notes. This child has been fine since day dot. Like, she hasn't caused us any issues. She's been gaining weight the whole time. She's up to date with our vaccines. Like, there is no notes. The only notes are we've come to under five clinic, which is what it's called in Zambia.
Okay.
Um, and he was like, oh, okay. Has she been constipated before? And I'm like, nope. And he's like, oh, okay, this is very like different. And I explained, no, we started solids and he's, oh, okay, right. Very common thing. Babies need to adapt to the solid foods and let's just give her some cream for the area that's sore right now. Give her some lactulose so that she can, clear out what's been in there the last week. Come back in a few days so that we can check on the wound area. Because obviously the position of where she had a cut, they wanted to just check it was still clean and stuff. So they gave us a suppository so that we could clear her out, and then also the lactulose. But unfortunately, the suppository they put in the hospital, she'd pushed out because you can't tell a baby not to push when it feels like it wants to push, right?
No.
7 6.5 month old baby. Um, so we then had to insert another suppository when we got home when we realized like, wait, this baby hasn't pooed. Like the suppository is supposed to make come out, so we had to do that ourselves. And I feel like that was the start of the journey. Um, Kept it on the lactulose, went back 5 days later, saw her pediatrician, and then he was like, let's just give it a month. Like, let's see if things are going to change. Let's see if it's a one-time episode. Let's see what happens. Keep her on the lactulose and do 3 times a day, and then we'll go from there. So 3 times a day on a lactulose, she was going. She went once a day or once every other day. And like just as normal. That was it. So then we went back to the hospital, and he said, okay, let's lower the dose of the lactulose and see if that changes anything. So then we actually went on holiday. We went to Dubai. We met my parents in Dubai. We went for a week. My parents came for a long weekend. They had no idea of what had gone on at this point because there was no need to tell them, no point to worry them. And then we had to give her the lactulose, obviously, when we were there. So I said, look, she's having this because she's had a bit of problem pooping, and that's that. At that time, we had no idea Hirschsprungs even existed. And funnily enough, in Dubai, she was just going like there was no stopping her. Um, so we were like, oh, maybe she did just need a little bit of lactulose. And she was eating more. She was drinking all of her bottles. She was even drinking a little bit of water. Like, she was great. We went back to Zambia, went back for another appointment, and we told him this. So he was like, okay, let's lower the dose. And then he said, look, also on you a prerogative now. He's like, we're going to give her another month. Let's not keep her on the lactose if she doesn't need it. Because you just told me she's had a week, 10 days of greatness. So let's put her down to twice a day. then keep going, put it down to once a day and stop if things are going the same. So we got down to the point of giving her a dose down to once a day and then nothing for like 3 days. And then she didn't go again for 10 days.
Mm.
So it's like something is not happening. Went back again. This was now like 8.5 months old. And he was like, okay, let's put her back on the laxatives, put her back on the lactulose. Maybe it's something she'll grow out of. You know, there's a lot of things babies grow out of by the time they're one. He's like, I don't want to go into anything serious, anything invasive, if she's going to grow out of it. Because remember now she had none of the textbook symptoms.
No.
He actually threw the word Hirschsprung's out and said, we don't want to go into anything invasive like Hirschsprung's when she doesn't have any other symptoms
Okay.
at the time, right? He is a Lebanese doctor.
Yeah.
Um, and he said, let's just go back to where we were, go back on the laxatives and go from there. Okay. So then we noticed she would always poo in the car seat. Whenever she was in the car, the moment we got in the car, she would go. The moment she was in the bath, she would go. But
Okay.
any other time, she wouldn't. Remember, she was still on the laxatives though,
Yeah.
right? So then the next time we went back, I told him this, and he was like, okay, let me examine her again. So then he was like, oh, actually, it looks like her anus is a bit anterior.
Okay.
Maybe there's something inside that is not quite lining up. And I'm like, okay. I mean, I definitely haven't studied holes in my life, so okay, I'm gonna listen to you on that one. And he's like, but no, that's me looking really hard, like
Yeah.
it's not something you would have noticed, definitely not to an untrained eye. He's like, I'm clutching at straws because you're saying, these positional things are happening, right? We're thinking more about those things. He's like, let's just hold on till she's one. I'm like, okay. So we kept going, but at this point now, she's not gaining weight. She was 6.5 kgs at 6 months and she was 7.2 at one, right? But she was drinking her milk, but everything was then coming out, right? She wasn't thriving then. That failure to thrive word that they throw around.
Yeah.
Um, she wasn't. But she was happy as Larry. Like she was fine. She was not irritable. You would not look at her and think, oh, she can't pull. Like she's having trouble. She's a bit irritable. No, like not at all. And we always knew, like, if she'd had 2 or 3 days where she hadn't gone, even with taking the laxatives, like, oh, chuck her in the car, go for a drive, she'd be right. And she'd go, right? It was madness. So I don't know if there was something to do with her positioning of her being able to get a bit of oomph behind it or what, I don't know, right? Um, but that was what was happening. So he was really leaning more towards there was some sort of positional something, right? Um, Then we got to the Christmas time. We went to the UK for Christmas and she just ate anything and everything and was drinking all our milk again. I'm like, does she just need to be on holiday? Like, does
Yeah.
she
It's just.
feel relaxed and everything's okay? Like, we had to put the lactulose dose down because she was going quite often. Like, she didn't have diarrhea, but she was going more often. And I'm like, oh, is it changing water? But then, like, we don't give her, it's bottled water she has in Zambia anyway. And she wasn't really drinking much water at that point because she was still on breast milk. She was only 10 months, 10.5 months. Um, and like, I looked at my own diet. I was going. So my breast milk was fine. It was all of those things. Let me eat a high fiber diet. Let me change this. Let me change that and then see if that helps. So anyway, we got back in the January. I had an 11-month appointment because we kept going back once a month because he was like, no, let me see you once a month just to in case there's any changes. But when we got back after that we'd had great Christmas, hadn't we? So he was like, look, let's stop the lactulose then. Clearly she didn't need it the last couple of weeks. Let's just think her first birthday is in a couple of weeks and we're at the end of it. And then We went.
No.
Um, we went. We were at the Star. Um, so we went for a appointment. She turned one on the Sunday. We went to the hospital on the Tuesday, and I walked in, and he went, "Oh, I really wish you hadn't come. Like, I thought we were done. I thought that was it. I thought we'd hit the nail on the head, you know?" And I went, "Yeah, no, she hasn't pooed." And he was like, "Ah, okay." And he picked up the phone and he called a pediatric surgeon there and then. He said, "I've got a baby I need you to see, and I need you to see her now." And we saw her on the Saturday.
Mm.
Imagine that now on the NHS. We saw her
Yeah.
5 days later, right? And he said, "Look, I'm not going to worry you and throw things at you that you can go and Google between now and Saturday." And I went, "Thank you."
Yes.
He
Yes.
said, "Look, we've already spoken about a few things." I couldn't remember the word Hirschsprings at that point, and thank God I couldn't. All right. And he said, "Look, we have spoke about the anteriorness. Maybe that's it. Let a surgeon see it." He's like, "I'm a pediatrician, but I'm not a surgeon." Right. So I'm like, okay. So on that Saturday, we saw her. She did first did an X, obviously examined her and said the same as him of like, maybe, maybe, because it's like borderline, you know?
Hmm.
It could just because she's quite a petite child anyway. I'm 5 and some change. My husband's always not tall either. She was never going to be 6'2", right?
It'd be a bit odd if
So
she was.
she's petite anyway, right? She was always going to be petite, Hirschsprungs or not. So she's like, ah, maybe it's just the way she's built. Like maybe it's not a reason. So let's look inside. So they did an X-ray. Obviously couldn't see too much through that, but she wanted to see like her pelvic bones and see if there was anything to do with that. And she was like, look, I want to do a contrast enema. So the following Tuesday, yeah, 4 days after that, we had the contrast enema. Now we weren't really told what that was going to entail,
Hmm.
honestly. Um, and when we arrived for the appointment, it was like, oh, we need to wait for the anaesthetist. And I was like, excuse you,
Hmm.
my child's going to sleep. What? We weren't told any of this. And they were like, well, she's a 1-year-old. Is she going to sit to have a contrast enema up her anus, you know? And I was like, well, I don't really want to go to sleep if she doesn't need to as well, because no, she's one. Uh, no, can somebody talk me through it here, you know?
Yeah.
Um, so the guy that does the enema, I don't know what the official, I don't, he's a doctor, I suppose, but I don't know what the official name is for it. He was like, look, if you want to try, we can try. It might take 15 minutes altogether. Um, and we were like, okay. So we held her. Um, and yeah, I don't really want to talk about that bit.
No, no, no. That's absolutely fine.
Right?
No.
We
Yeah.
held her, and that happened.
Yeah.
Um, and then you can imagine what happened after the enema, uh,
Yeah.
right? Which again we were not prepared for. Luckily, I still had the X-ray apron on,
Yes. Yes. I
right?
imagine.
You could just see the fear in this child's eyes of like, what is going on right now? Like
Yeah.
things are flying out of me, and I don't know how and why, and I can't stop it.
Yeah.
You could sort of see afterwards that she was relieved,
Oh, I bet. I
right?
bet.
Like, even though she was never a child that was irritable, you could suddenly see she was relaxed,
Mm.
right? And it's one of those things of like, oh my God, has she felt some type of way all this time? But because she's always felt that way, she doesn't know what relaxed feels like then, you know? Um, and she always been in some sort of pain. We have no idea. And she's never going to tell us. She's never going to know, right? But you could just see she was sort of relaxed. And I just remember leaving the hospital and looking at my husband looking at me like, we don't need to ever talk about this again. This happened. It is what it is. And let's go home. And we actually had a friend of ours visiting Zambia at the time. And we walked in and she just went, tea or vodka? And she could just see our faces. It was like 11 o'clock in the morning. I was like, in 5 minutes, I think, a minute. Get you in 5 minutes. She's like, hey, you just let me know. When you're ready, you let me know. Because she was like, I Googled contrast enema as soon as you walked out the door.
Yeah, of course you do. Everybody
Right.
does.
And that was that. I didn't though. I didn't because I was like, I don't want to. I'm scared. I don't want to. So I
Yeah.
actually didn't. I knew something had to go into her so that they saw it on a scan, but I didn't think about it and process what something had to go into it for a scan, you know?
Yeah.
I was very naive, I think, with a lot of the things because there's nothing wrong with that. She just can't poop, you know? There's nothing wrong with that. There's nothing wrong with that. She's fine, right? And then we waited about 2 weeks after that. Wait, no, it was about a month, was it? No, sorry, hang on. I'm trying to think of the math now. That was like the first Tuesday in March. Then it was the April that we went and decided what was going to happen. So it was about 3 weeks, I think. It
Mm.
was about
Yeah.
3 weeks. Um, but in that meantime, so the surgeon, she was visiting that hospital, right? So she works out of the main government hospital, or two, sorry, there's two main government hospitals. She works out of one of those. And then she visits a couple of private institutions, like on the weekends and stuff, right? Um, so she wasn't supposed to be at that hospital until like the following Saturday or something. And then she had an emergency, so didn't go. And then she was on a work trip. So we probably would have had the results the 5 days later, but because it just didn't work out, it took us 3 weeks, right? And they were the longest 3 weeks, obviously.
Yeah.
Um, but then I also knew that maybe from that enema we still wouldn't have had the answers. So I was like, well, as long as we got to wait, we got to wait. It is what it is. We just kept it on the lactulose, right? So then I'd had a message from the surgeon to say, look, I've seen them, I've got them, the as in the scans. Um, when are you available for us to meet? I'm at this hospital on this day, this hospital that day. So we actually weren't that pleased with the care at the private hospital for what we were paying insurance wise.
Mhm.
After the enema situation, there was a lot that went on that day, and like I just didn't want to see anybody there ever again. So the fact that I could see the surgeon elsewhere, I'm like, let's go there. So we did go to a government hospital in Southern Africa, which afterward people were like, are you mad? And I'm like, well, it's what we've got dealt, and you go to see the surgeon rather than the facility, right? So we saw the surgeon. She brought the scans up on a computer, and she was like, look. And I'm like, at what? I have no idea what things are. So she showed us like a normal digestive system and then her digestive system. And the sigmoid area was just huge. All I could think of it being like, a long balloon, like balloon animal type balloon. It was just huge. Like it was just her intestine was so enlarged and around, and it was wild, like scary. Like it was huge. And then she explained to us like it works like a muscle. When it's worked, it gets bigger and all that sort of stuff. And we were like, okay. But then she's like, look, from what I can see from the scan, she's like, clearly there's a problem,
Hmm.
but I still don't know what that problem is. I
Okay.
know I need to go in, right? Whereas there's actually somebody I met through the Hirschsprung situation. Her daughter also had Hirschsprungs, but was more of a textbook case of didn't pass meconium. Um, and she's actually a radiologist. So she looked at the scans afterwards and she went, oh, that baby got Hirschsprungs
Mm.
because she could tell the way it was and obviously her experience with her daughter and all of that as well, right? And maybe the surgeon thought it at the time, but didn't want to put it out there till she had biopsy confirmation, right?
Yeah. Yeah.
So she suggested after that was let's take her to theatre. Right, no, now I've remembered. It wasn't 3 weeks later because on the 13th of March she had the biopsy. So it was about 10 days later. The longer wait was between the biopsy results and seeing her again.
Right.
Sorry,
Okay, that makes sense.
confused
That
myself.
makes
Yeah.
sense.
So between us seeing the surgeon on the 15th of February, she had the biopsy on the 12th of March.
Got it.
right? So we'd already had the X-ray, the enema, and then into the biopsy.
Yes.
So the hospital that we did the biopsy from, they only do elective surgery on Mondays. So we always had to be admitted on a Sunday for the surgery to be done on a Monday. Elective ped surgery. Then their time slot for the ped surgery was on a Monday. Obviously, if an emergency came in, it is what it is. Luckily for us, that never happened, and for everybody else because there was no emergency. But yeah, so she was taken to theatre. But they were checking for the sphincter muscles to see if it was something to do with maybe like a lazy sphincter muscle that wasn't working properly all of the time. Um, was anything anterior? Was anything out of position? And then they said, look, mean as we're going in, let's take a biopsy and we send it off. And we were like, okay. And her words at the time were like, to rule things out, not
Yeah.
in, right? So I was like, best case scenario, they come out here and tell me that she's got an anterior anus and that's just the way it is, right? And maybe they like might have to do some sort of surgery to like maybe make it wider or I don't know, right? So that was the longest 45 minutes of our lives,
Yeah.
right? And it's not like it is on the TV, guys. You don't get to go in and hold your child's hand and count sheep. Not at all, right? Doesn't happen. You hand your child over, and that's it.
Yeah. I can
Right?
imagine that is
It's not like
the
it is on the
most
TV,
terrifying, the
right?
most terrifying thing
And I
imaginable.
bawled.
Yeah.
I absolutely bawled.
Yeah.
And then it was like, right, calm down, calm down, calm down. You can't do anything. She's in safe hands. It is what it is. Um, and that was that. She came out and she was awake and was like, fine. Like, honestly, was really okay. And when I say the child is strong, this child is strong. Right? She was okay, and we were discharged in the afternoon because she was okay. She had no fever, she had no vomiting. We were told, look out for those things. But she was fine. She went home, she slept 12 hours, she was great. No problem. And that was that. She was a bit sore down below. We had to make sure, she wasn't bleeding or anything afterwards. She was okay. Um, Then the way things work in Zambia is you can have things tested in the government facilities, but you may never see that again. It may take 6 to 12 months. It may take God knows how long. So we went insurance route for the biopsy. Um, so yeah, we were given the test tube with the bit of intestine in, with a stick around it with our name and date and what was in the bottle, and we had to take that to the lab.
Okay.
Mm-hmm. Yeah,
Okay.
right. Wasn't ready for that bit either.
No, no, I can't imagine anyone told you that was going to happen either.
Mm. And I remember it being like, oh, so here's the sample. And I'm like, sample of what? Excuse you? And then she's like, to go to the lab. And I'm like, oh, we got to take it. And then she's like, yeah. And I'm like, okay. And then I just
Right.
looked at my husband because I was like, I ain't taking that. And he just
No.
looked at me like, I ain't either. So what are we
So,
gonna do here?
someone's
Right?
got to get it there.
Right. So the thing was, there was a nurse with us because they had to take us back down to the ward, right? So the nurse was like, took a glove out of our pocket and just put it into the glove, and we walked down the stairs. And I'm just going to my husband, what do you think we're doing with her? So he starts talking to the nurse, like, we weren't told anything. And they're like, no, you want to take it to the private lab, right? I'm like, yeah. She's like, yes, you need to take it. I'm like, okay. So I have a friend who works for like I want to say biotech company. I don't know what the right word is, but deals with like lab equipment and testing and all that sort of stuff. And she's Irish originally, but living in Zambia. Straight in the blower to her when I'm like, they've
Hmm.
just given us a test tube with a bit of whatever in. What do I do with it? And she's like, yeah. And I'm like, well, you could have told me that. She was like, well, I thought you knew. And she's like, oh,
Why would you
what do
know?
do you want me to come, do you want me to come and get it? And I'm like, and then my husband's like, no, we'll go and take it. It's fine. We need to do it the first time, make sure everything's right. And then she was like, do you want me to meet you there? And I'm, no, it's all right. Put your big girl panties on. We'll do it. We'll get it done, right? And even to this day, I'm still like, So that was a bit weird, you know? But it wasn't the first time, was it? Because there was more after this situation. But anyway, right. Continue with the story. Um, so that was that. We were told it would take 10 to 15 working days because they actually send the samples to India,
Okay.
right? Everything's outsourced and sent to India. And that would have cost us, I think, about 85 quid, pounds, British sterling.
Okay.
But my husband's government insurance, my husband works for government in Zambia. Um, so with his health insurance, it actually covered it. The private lab was actually covered under the insurance.
Oh,
We never paid for anything of her surgeries.
wow.
Everything was covered with his local insurance, which I don't think many people realize how good that local insurance actually is.
Mm.
Because, a lot of Africa still is very taboo with medicine and going to the doctor in general. They'll just drink a tea and be like, no, I'm all right now. Very much witch doctor medicine and stuff is there. It is still very much a thing. But people are coming round to medicine, right? Anyway, so we were told 10 to 15 days. It was, we took it on the Tuesday, took the sample on the Tuesday. We got the results the following Thursday. So it was like 9 days, not working days, 9 days general.
Okay.
Now, the thing was, those results were sent directly to my husband's email.
Mm.
So then I was there, old Google. And I was like, this child got Hirschsprung's disease. What? Sent it to the surgeon, and I was like, can you please confirm what I think these results say?
Yeah.
No response for a while. She's a surgeon, clearly busy. I'm not her only patient, do we?
No.
We then have doctor friends. I'm sending it to them now. Can you interpret this? Can you interpret this? And they're like, look, we can, but we're also not a pediatric surgeon. So we don't want to tell you the wrong thing and worry you and this. And one of our very, very good friends, um, that we actually met in China, where me and my husband met, and very, very good friends of ours, is a doctor. And he called me and he was like, look, whatever you're reading is probably right. I'm not going to confirm or deny anything, but please just don't like freak out until you've seen the surgeon and you know what the next steps are. And I just said to him, but this isn't going to go away, is it? And he went, no. But he doesn't know enough about Hirschsprung's and everything to like, he's not a surgeon, right?
No.
And not a ped surgeon either. So he was like, this isn't going to go away. It's not something that's going to go away with medicine. Something's going to have to happen, but I don't know what. So I don't want to freak you out and I don't need to overthink. Just wait for the surgeon to respond. And I'm like, okay, cool.
Was that helpful or not helpful?
It was one of those things of like, I know why she's not pooing now,
Okay. Okay.
right?
Yeah.
But then also at the same time was like, what's going to happen now? Like,
Yes.
what is the next step, right? So then another family friend of ours who was in the UK, who is a GP now, um, she sent me some literature on Hirschsprung's, which to this day is still quite useful. I got a feeling it's maybe BBC. I'll have to check the link. I'll have to find it where it is. And it's just like a 3 or 4 page leaflet, very straightforward. What's going to happen? Stoma, reversa, that type of thing, right? Very standard procedure then, right? Textbook standard procedure.
Yeah, if there is such a thing, as we
Okay.
said before.
I was like, okay, right. So I had some idea, but then I was like, but she didn't stop pooing until she was 7 months. Maybe it's different. Maybe it's not going to need all of this, blah, 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 blah. So we then went to see the surgeon the first week of April. So that's when she said, look, we've had a confirmed Hirschsprung's diagnosis. That was not what we were expecting because of blah, 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 blah. But from the contrast enema, I knew it was a possibility, but we wanted to rule everything out.
Yeah.
And I'm like, okay, so where do we go from here? And she's like, look, there are different routes, there are different scenarios, and in different countries. She's like, you do have the UK as a possibility if you were thinking of maybe going there now for if you wanted a second opinion, all of those things. And then also a lot of people go to India from Zambia and a lot of people go to South Africa because they have like better infrastructure, they have more doctors, they have um more facilities and just everything in general. There's more of it and it's more I don't want to say proper, proper's not the word, sophisticated. There we go.
Yeah, yeah.
Um, so there are opportunities for different ways of getting things done. And she told us about frozen histology, of a way of like you can be on the table and take out more intestine and test it there and then and do things quicker. But I think she's thinking more like super high tech. I don't think she's ever researched the NHS at this point. But she's like, that is something. She's like, I don't know if that's a possibility for you or not, but it would mean no stoma, right?
Okay, yes.
Right? Because it can be done there and then, you wouldn't need the stoma part of it. There was obviously the route of stoma, bowel resection, stoma reversal. Um, and she was like, these are the options. This is the way I would do it. This is the way I would suggest doing it. Then she also said about the thing of 85% of Hirschsprung's cases are short segment, 15% are long. There's no way to know that until you test further in,
Yes. Yeah.
right? So she was in the mind frame of why put her through all of this to remove the sigmoid side, and then actually she's in the 15%.
Okay.
So she wanted to do further biopsy, which is why she spoke about the frozen histology part of it, because she's like, if they go in and do the further biopsies, frozen histology wise, then you'd know there and then what are we taking out. You do the resection there and then,
Yeah.
right? Um, so in places like, well, I say some places in India, which that radiologist friend of mine, what they went to India with her daughter, and they knew she was long segment,
Okay.
because of the way everything was, and she had a stoma from birth to 11 months. That's when
Right.
she hit 12 kilos, which was what they wanted for the surgery. Then they took her to India and they did the bowel resection and the reversal at the same time.
Okay.
But she only now has 8 centimeters of intestine.
Yeah. That's a tricky
So
one.
she's on the opposite end of now pooing too much.
Yeah. Yeah.
And
So
she's
just
only,
not enough stuff to.
she's similar age to my daughter, because she's two-ish.
Yeah.
Um, anyway, that's somebody else's story. But we were told these options, right? And I was like, I I would go to the UK or I would do it in Zambia. I don't feel comfortable going to a third country.
Right. Yeah.
That was just my opinion.
Hmm.
My husband's Zambian. We've got insurance here. We've got friends who are doctors here. We've got a support system here. We go to the UK. My family's in the UK. We have a support system there. If that's what we're going to do, that's what we're going to do. Now, people assume when you get married to somebody from the UK, you can just go and live in the UK. You can't. Right?
Nope.
A lot of people that say to me, "Oh, so he's got a British passport now, is he?" I'm like, no, not even close.
Nope.
Um, so we were like, he has a 5-year visa at the minute, so can come in and out for 5 years, but can't stay for longer than 6 months. He also has a full-time job that he could have taken some leave from, and luckily they do have an option of like longer leave and unpaid leave and all that sort of stuff. And we were like, look, however long this is going to take, we need to be together for it. So are we going to go to the UK? Shall I go at first? We know what they're going to confirm. And then you come once the surgery starts. And then in my head, all of a sudden, I'm like, it's not going to be as quick as here,
Yeah.
right? Not at
Yeah.
all.
No.
Then this is when we had to like feed my parents in on it and be like, look, this is what's happened. This is everything that's going on. What's going to go from there? So my mother works for the NHS. She manages an outpatients department. So, has a lot of friends within different departments because she manages their clinics and things like that. So obviously you're going to ask a friend a question of, have you ever heard of this? Have you ever heard of that? And actually the hospital she works in doesn't do pediatric surgery, like as in elective staff. Um, so nobody really knew a lot about it because Hirschsprung's, again, textbook, usually more younger than older, right?
Yes, yes.
Um,
Never been the
and
case though.
yeah, and even our GP, she's only ever heard of one case of Hirschsprung's in
Yeah.
the valleys of South Wales, you know? There was only one in her career, and she's, I want to say, definitely late 40s, if not in her 50s now, I think.
Wow.
Um, and I'd only ever heard of one case, you know, not familiar with it at all. So, to even get a referral and all that stuff, we knew it was going to take time. And, my child is not unwell currently. Okay, she can't poo, but with laxatives, she is going. So we never had washouts or enemas apart from that contrast enema, which again is not the usual of Hirschsprung's. So because she was going, it was like, oh, maybe she is short segment because it's not like as serious. But then with what the surgeon was telling us, it was like, look, we still need to check, but also it's the same procedure, whether it's short segment or long segment. You have the stoma, you have the resection, you have the reversal, right? So the other thing to throw into the mix at this time was we were moving to China in the August. This was April. Yeah. Um, and my family at the time had no idea about that.
Okay.
So we were like, well, if we want to get it done, we've got to get done. And in
Yeah.
my head, I'm like, it's going to be done. As I said, I'm very type A. It'll be done. It'll take this amount of weeks and it'll be done, it'll be done, it'll be done. Um, and we were actually supposed to have been going to Greece for some friends. Their child was getting baptized. It was my 30th birthday. So we were going and like having a nice party and whatnot, having a couple of weeks. We were going to the UK for 10 days then, means we were on that side of the world. And then we were like, right, if we need to go to China, we definitely need to get this done now.
Mm.
But also, we've just been diagnosed with some sort of disease. Forget everything at this point apart from the child, right? But then again, talking with the surgeon was like, look, she's not unwell right now, but she's not going to get better.
No.
She's not going to get better. She could stay the same for years and years and years. If you want to keep her on the laxatives, right? But she could get worse and she could get worse quickly. And hearing those words, it was like, you know?
Mhm.
Um, and we went back and forth, we ummed and ahed. We consulted as much as we could with friends who were doctors and midwives and medical personnel and just people we just looked up to for advice and, stuff like that. And we came round to the decision of let's get this done. I felt very comfortable with the doctor in Zambia. Um, she'd studied abroad. She'd had extensive training. She'd studied at the Royal College of Ireland. Um, a very good friend of ours in Zambia, who's also a medical professional, who's Irish, did a lot of her stuff in India, then South Africa, then Zambia. She's a midwife, nurse. She was like, I know this lady. I would trust her. And after that, it was just like, you know what? Let's just do it. And then whatever follows, follows. Right. And that's just the way it is. So we said, okay, let's get it done. So she had the stoma put in on May the 13th, which again was a Monday. The Sunday was Mother's Day in Zambia. So my Mother's Day was spent in getting admitted. She had the stoma put in on the Monday and the biopsies as well. And honestly, that freaked us out a little bit more. Was seeing the scar from the biopsies rather than seeing the stoma.
Right.
because it was quite long. It was about maybe 8 centimeters or so
Okay.
on a 13-month-old baby.
That's long.
Sorry, 15-month-old baby,
Yes.
right? It was big. Um, it's a university teaching hospital. So, there's always students around Monday to Friday, especially in the mornings when the doctors are doing their rounds at 10 o'clock. There's always students around. There's always too many students. There's the doctor, plus the junior doctor, plus a nurse who's on duty, plus the parents in the room, plus the child, and another bed in the room as well, right? Luckily, a lot of the time we didn't have another patient in with us, but sometimes we did. And I remember my husband was sat in the corner of the bed holding her. She'd just fallen asleep. Doctors always come when the child has just fallen asleep. It's like they
It's
know.
annoying, isn't it?
They know. They know. This child has taken this amount of hours to settle. Let's go in and check something. Sugars usually. Let me prick that finger. Anyway, and I just remembered him being like further and further up into this corner because all of these students and everything just came in and he couldn't go anywhere. And I'm just looking at him and he's looking at me and the doctor's like, okay, let me just grab her here. And she starts crying. And then I'm just like, I can't cry, I can't cry, I can't cry. And he's just in the corner like this. I'm stood now at like the foot of the bed, and can't like get to her because of all these students in the way. And obviously, I don't want to be in the way of the doctor as well because she's coming to check the wound, check the stoma. This was the day after, and the stoma had become active in the night. This was
Right.
another thing we were never told. To me, it was like just going to come out, right? But it took quite a time. Like it was, she had the surgery in the morning. She came out of surgery, I want to say around like 12:30, and it didn't go active until 2 in the morning.
Oh, wow.
Those were very long hours. And I'd gone home to sleep because, okay, wait, we'll go back into that bit in a minute. So yeah, basically the doctors came in, he was in the corner, and I was just stood there, and she removed the dressing, and I just went, and I could see my husband like as well. We were like, oh, we weren't bothered by the stoma. We knew what the stoma was going to look like,
Yeah.
right? We'd Googled that, we'd YouTubed that. And then we were like, hey, why you didn't get that something? Because in my mind, again, I was like, oh, maybe they went in through the bum, like maybe that was that. But they had told us they were making an incision, but I just, just didn't click,
No.
because it was just so much information and there was no one to really talk us through it. And when you're a doctor, all these things are daily stuff. You don't think of it being big things, right? And I remember the doctor actually apologized to us at one point, and she said, I've thrown so many words and things at you that sometimes I need to step back and think these people don't know what's going on.
Yeah. Yeah.
Right?
It's your first time. It's their however many,
Hundredth and thousandth, God knows, right?
Exactly.
Yeah, so that was one thing that really did throw us. The thing I was just about to talk about was in the UK, you have stoma nurses, right? You have
Mhm.
units that you can go to and get checkups, and you get all of your stoma supplies. You don't get that in Zambia. There
Right.
is no such thing as a stoma nurse. There's nurses that have seen stomas. There's
Right.
nurses that know what a stoma is. There's surgeons that put a stoma in but don't know how to care for it.
Okay. So
Surgically, they can do it,
yeah,
but nursing care, nothing.
it's quite
All right.
disjointed then.
Mm. Um, and the surgeon that we use, she actually has her own private clinic as well, like pediatric clinic, and she's trying to set up like in-home care service or like an after surgery care service, obviously paid for, um, and try and get that up, like elderly care service, that type of thing. Just bit of hospice care at home, respite, all that sort of stuff. We don't have that in Zambia
Right.
unless you're going to pay a private nurse to do it. So she's trying to set up something that's more affordable and available and accessible. So through this, I said to her, like, is there someone we can have to help us? So my parents were very generous with us, and I suppose it was for them to feel like they were helping in some sort of way as well, from being so far away. And they'd said, "We'll come to Zambia, we'll come to Zambia." And I'm like, "What for? You're not stoma nurses. Like it's not going to do anything you being here other than you like physically being here, because emotionally you can be on the phone or you can be there, right? Unless it's never you being physically here, there's going to be no difference. Um, so like it's okay, and we came to that decision between us, and we're like it's fine. Um, but they paid for us to have 24/7 nursing care for a month,
Wow.
right? Um, do you want to have a guess how much that was?
I couldn't even think of a figure off the top of my head.
It was about 500 quid,
For a month.
24/7 nursing care.
Wow.
That was two nurses on shift, 12 hours on, 12 hours off at our house.
Wow.
Yeah. If only it was as good as that.
Yeah,
As in,
I'm
as long
shocked.
as the problem was we had some nurses that had stoma exposure but
Okay.
weren't equipped
Uh,
to care. But in those first few days when we were still in the hospital, it really helped to have someone there to interpret medical lingo.
yes.
Right? So it helped in that way. It also helped us emotionally to be like, oh, there's somebody here. If she's got a temperature, that nurse can tell me, oh, no, it's okay. It's just this. Or let's wait and check again in an hour. Or,
Yeah.
those types of things where you're like, oh my God, she's had surgery. She's got a fever. Clearly, she's got an infection. Right? It really helped with that sort of stuff. But unfortunately, the stoma bag wasn't cut to the right size by someone, and then she had extreme excoriation, and I mean extreme to the point we couldn't put a bag on her. She had we were just using either Vaseline or Sudocrem, which was the only thing available to us,
Yeah.
with gauze and then a nappy around her waist,
Yeah.
um, taped, and then her diaper on top of that, like a nappy on top of that. Sorry, sometimes I say diaper, sometimes I say nappy. Talking to a Brit, nappy on top of that.
We know what you mean. It's all right.
Yeah, on top of that as well. So, that's not comfortable,
No.
right? And then because of that excoriation, the minute that stoma is active, you have to change. You have to wipe her, you have to clean her, you have to change it. She also had an ileostomy. So it was diarrhea all the time, basically, right? You have people with colostomy bags that drain their bag, not even drain really, I suppose, because it's more solid, right?
Mm.
Once a day. We were draining her bag around 10 to 12 times a day on a good day.
Yeah.
Because we're trying to get as much in there as possible. Because with a high output stoma, you need to be making sure she got fluids in her and this and that and what and everything else, right? So we went 3 weeks without a bag, right? But it just kept getting worse and worse and worse. The Vaseline wasn't working, the Sudocrem wasn't working. She wasn't eating as much. She wasn't herself. Um, and then I don't know whether to say fortunately or unfortunately, I have a friend whose son was born without a rectum, in Zambia. I didn't even know he had a colostomy
Oh, right.
until people knew that, because I always talked about, oh, she hasn't had a pool, she hasn't had a pool, she hasn't had a pool, she hasn't had a pool. And then so people knew, like, okay, is she better now? Is she better now? So they knew everything we were going through. And we used to go to a play group. And in that play group, the lady that did the play group, it was her sister-in-law. So it was her nephew.
Right.
Small world.
Yeah.
And she came to the rescue. And when I mean rescue, to this day, I would not have survived this journey without her. Luckily, now her son has also had a reversal and is living his best life. And he's got a baby brother who has no complications and was born perfect.
Okay.
And he actually had his surgery at Great Ormond Street.
Ah, the best hospital in my opinion.
Right? And they paid for it. And they had some insurance cover it, some paid for it. They're actually South Africans living in Zambia. Or the dad is Zambian, or lived in Zambia. The mum is South African, lives in Zambia. The baby is South African, but he's actually on a British passport because he grew up in the UK and his mum and dad are in the UK. That's all crazy as
Okay.
well. But good news on that is he's had a reverse and he's living his best life and he's got a little brother with no problems and everything is fine.
Great.
Um, but fortunately for me, I had her as a lifeline.
Mm.
And even through it, like she'd cry to me over stuff with her son. And, it's one of those things where a bag is working for you and then suddenly it's not. That brand is working, then suddenly it's not. The strips you're using on top are working. Now they're causing a rash. All of those things, only we could relate on those things,
Yes.
right? Um, but she came to the rescue. She's also a pharmacist by trade, so she also had some medical lingo, right? She knew a lot of things. I trusted her more than I would have trusted anybody else with a stoma at that point because she had the medical knowledge as well of certain things. She was telling me, try this type of cream, try that type of cream. And then she's like, look, I'm going to South. Let me try and bring some stuff back for you. But she was going to be out for like 3 weeks. They're not even sending stuff from South. You have to pay for it. It has to take a few days to come. We had to deal with stuff there and then. So she brought some of the things she was using on her son. And she's like, look, again, stole my life. This might work on him and it might not work on her.
It's everybody's
Right?
different.
Yes, but she also told us about an NGO, a non-profit organization, non-government organization, non-profit charity basically in Zambia called Stoma Care Support. So this guy, a Zambian guy, had a colostomy, um, and he was 40 something, not Hirschsprung's related. I even forgotten what it was with him now, but he had some sort of bowel obstruction or twisted something. Anyway, um, had no idea what a stoma was and was told you're about to have a stoma put in on his way to theatre because he needed
Okay.
it done there and then, right? He's a very religious man, and came out of that whole situation. He's now had a reversal and is living fine, but came out of that with God gave me this to help other people.
Okay.
So he had to source all of his stuff from Zimbabwe and South Africa at the time, and faced all of the taboo of, you're having a stoma and the pool situation. And he'd recently got married, and it was very much a thing of, oh, your wife's going to leave you because now you're not a full man and all of that stuff, right? Very, very, very raw things. She did not, and they have a beautiful baby girl and
Good.
good people.
Mm.
But anyway, he came out the end of it and said, no, I got to do something. So started this NGO with a couple of his family members who actually worked for a different NGO at the time and things like that. So they had the knowledge of what to do, right? And he came to our house with literally what I would say a bag of goodies, a party bag of stoma supplies, and was like, try this. If that don't work, try this. If that don't work, try this. If that don't work, try this. Um, baby was sleeping at the time, but I had photos, so I showed him, and he was like, "Ooh, you need help." And I'm like, "Yeah, I know." Um, so we used different types of creams, different types of powders. We mixed creams and powders. We used a spray, which came from South Africa from the friend, um, and that cleared up the excoriation to the point of we managed to get a bag back on her when she came out of the reversal, sorry, out of the resection surgery. So
Right.
she had her bowel resection on the 10th of June. So between May 13th and the 10th of June, May 12th, May 12th, 13th, anyway, and the 10th of June, she had the stoma, and then went in for the resection. So they removed 12 centimeters. So she was confirmed short segment.
Okay.
Um, I forgot, missed that bit out. Yeah, confirmed short segment. They removed the sigmoid part, the rectum, and then did the pull through procedure, and made the new anus as well at the same time. Um, but we were never told about dilatation until after,
Okay.
right? Which was actually the worst part of it for me, because I'll
Okay.
tell you how it happened. So yeah, 10th of June. We also weren't told we were going to ITU afterwards. Um, so we were like moved to the other ward. Well, it was on the same ward. It was still the pediatric surgical ward, but you were in the like high dependency. Um, I would say, zoo because it was just glass. They could see straight into you from the nurse's station. They could see you directly, and there were four beds in there. So anybody walking past was always looking in and whatnot. Like to me, I just felt like I was fishbowl rather than zoo.
Yeah.
I was a
Yeah.
fish in a fishbowl, right? Um, and we were in there then, obviously with other patients as well. And unfortunately, two out of the other three were burns patients, so they had to keep the room warm. Um, and Naleli ran a fever, and I'm like, guys,
That's not.
keep it cool, not warm. And
Yeah.
it was June, so June for us is winter in Zambia. Naleli was naked, like I had her on a puppy pad type thing, so that she didn't even need to have a nappy on. But we managed to get a bag on her. And again, we weren't told that like it went into shock. The stoma was in shock. We had to wait for it to come active again. So I was like, why is nothing coming out of the stoma? Why am I not draining it? It's been 12 hours. And it's like, oh no, it's because the bowel is in shock. It's been played around with. And we're like, hmm. Before, not after, right?
Yeah. Yeah.
So we learned a lot along the way on the job training, should we say?
Oh, yes.
Um, and we were there just over 48 hours on the HDU, and then we were took back to a room, side ward type thing, two beds in a room, but we were on our own, luckily. Um, on the Wednesday, yeah, on the Wednesday afternoon. So the Monday was the surgery. This was the Wednesday afternoon. But we were also told the surgery would be between 3 and 4 hours, and it was 7.5.
Ooh,
Mm. Now that was a long day.
yeah,
At least I was prepared for handing her over
from the last time.
from the last time, but I
Mm.
wasn't prepared on having her back because 7.5 hours under anesthesia is a lot different to 30 minutes,
Oh, yes. Huge.
right? So
Huge.
she was out for the count, obviously, on this massive bed, like a normal hospital bed. She's just this little baby on it. Um, the other thing we had to do was we had to give blood because we had to make sure there was blood if in case she needed a blood transfusion. Obviously in the UK, you just know, oh, there's always blood available. It's not usually what happens in third world countries.
No.
So the only way to guarantee she had blood was that we had to go and donate, and
Yes.
then we had to get the numbers, and we had to give that to the junior doctor the morning of surgery, so that they could call the blood bank and say, this patient has had blood donated. We need to be given this amount of units,
Okay. Makes sense.
right?
Yeah.
Um, So luckily, both me and my husband are the same blood type. So she's the same blood type.
Oh, that's
So we
handy.
always had we always had that, assurance of there was somebody else to give blood if needs be, right?
Yeah.
Um, but she did need a blood transfusion, but she only had, I think it was like half a unit, I think.
Okay.
She didn't need a lot, but she did need some. Um, But obviously they do that, like they put the drain into her for that as like she's in recovery and coming out and whatnot, which again, I didn't know that. So like seeing the blood there and her and all of it was gruesome. To somebody who's not a medical person, it was a lot.
Yeah.
Yeah. And then came the bottle with what they took out of her.
I bet that was
Mm.
quite the
So remember
sight.
that little sample? We now had the bigger sample.
Oh, yes. And
And
you
the
have to deliver
bottle
as
that it
well?
was in is like an IV fluid bottle.
Right.
That sort of size. And then yeah, it was handed over to us and was like, look, any sort of human remains, be like by law, has to go to a lab.
Yeah.
So it's up to you what you do with it, but you can get that sent off now and confirmed of what parts have Hirschsprungs, and because they went in as far as they could and then a little bit further, right? Just to make sure you've got everything. Um, so it was like labeled with 5 or 6 different parts. Um, and luckily all of that came back clear and stuff. Of like, yes, this part did have Hirschsprungs, and then there was a part that didn't have. So it was what they needed to see, right? Everything was correct then. So we had that back about 10 days later, I think it was. I think we were still in the hospital. We were in hospital 9 days after the resection. Um, and we went home with a bag on. with no nurses this time because we were like, do you know what? I'm all right.
Know what you're doing.
We went through 7 nurses in that month because we had one nurse that was asleep during night shift. I had to wake him up to come and do a bag thing. We had a nurse that asked us what we should use around the stoma. We had one that just didn't turn up one day.
Oh, nice.
Um, yeah. Then we had one that was amazing, and I
Oh,
wish we could have just bottled her up and kept her. But she came to the hospital with us the second time, and she stayed the first couple of nights she couldn't stay because of HDU. Only one person could stay. And then once we came out of HDU, because we had like a couple of days we'd paid for, she was like, "Oh, let me come and like I'll stay the night with her and you can go home and sleep." But me and my husband, we just took shifts. We were like, "Look, let's do whatever works for us." Um, yes, I trust her here. She's probably better off being here medically wise, if she's got a fever or whatever, okay. And she was good to like chase up the other nurses because NHS are overworked. So is every other nurse,
of
right?
course. Yeah.
They're also very overworked. So she would like go to the nurses station and be like, "Oh, these are our obs. You don't need to come and see her. These are our obs." That type of stuff, right? So she stayed about three or 4 days. So it was nice to have somebody around, especially at 3 o'clock in the morning when you can't sleep and you're like, "Oh, what did you do today?" You know, have a
Yeah.
little chat, something, get to know someone. She was great, and even to this day now, she's amazing. She's still a friend, right? But we went home, no nurses this time, and she had no fevers. She was eating, leaving hospital. She was herself, because she'd already been living with a stoma for like almost 6 weeks at this point. So even though she just had major surgery, um, she was very much okay in herself. And the wound was they hadn't dressed it by the time we'd left. It had already healed and dried up. Like everything was okay with that. We didn't even need to keep cleaning it. It was all okay. Um, and then we were told come back on the 24th, which was 2 weeks after the resection. And I was like, "For what?" Um, and they were like, "Oh, so today now as you leave, we'll start the dilat. No, sorry. We're going to tell you about the dilatation part." And I'm like, "Mhm." Words, English, not medical.
Yes.
And they're like, "No, on Monday, we'll need to take her to surgery to use an instrument to dilate the rectum, the anus into the rectum, so that when the stool does eventually come through a stoma reversal, it's got a pathway." And I'm like, "What?" Because when they say instrument, I'm like, "What, a drumstick?"
Yeah,
Like,
yeah. That's the first thing you think of when you hear instrument.
right? So they're like, "No, we have a medical tool, but imagine like a candlestick. It's something like that." I'm like, maybe I didn't want to imagine it.
No.
Um, so I'm already like, "Oh, okay. Do we need to stay?" They're like, "No, like obviously she'll have anesthetic. She's not gonna let us do it, is she?" So obviously she's gonna be put to sleep, but it's gonna be like a quick thing in and out. And then from there you'll be able to continue at home. And I just went, excuse you? Like at home doing what? With
Exactly.
what?
Yeah.
And then obviously they were like, with with your finger. And I'm like, "Come again?" And they're like, "Yeah, we'll just use, some sort of lubricant or Vaseline on a glove, and then you use your pointing finger at first, and then sorry, your baby finger at first, and then move on to your pointing finger, and we start here and we finish here. Once it gets here, she can have the reversal."
Oh.
And I was just stood there looking at my husband, looking at the doctors, looking at the child, looking back at the husband, like, "Excuse you again?" "Wait, what?" And they were like, "Well, yeah, because we've done this pull through and it needs to be widened and all of this stuff." And I'm like, "No literature says this bit.
I can't imagine you got any emails from people
Nothing at
saying
all.
that.
Nothing at all." And they're like, "No, this is the way it's done and whatnot." And I'm like, "Okay, cool." Um, so at that point I was like, what if I'm doing it wrong? right? Like, I'm not a nurse. I don't know if it's feeling the way it's supposed to feel. I don't want to feel it in any type of way, you know? And I just looked at my husband looked at me like, well, it's not going to be me, is it? And I'm like, yeah, clearly. So at that point, my sister-in-law is actually a physiotherapist. So she has a lot of friends who did like nursing or physio or like have some sort of medical knowledge. And she had a friend at the time who was like looking for a bit of work. And I was like, do you know what? Let's give her something so it keeps her busy. And then she can come home when my husband's not there. As in, there's always somebody then in the house. Like if I need to pop out, there's somebody who knows how to drain the bag. Because it's also very common in Zambia to have like a nanny or a maid or a helper or whatever. So we had we'd say a house help. I don't like
Yeah.
the word maid.
Yeah.
Um, Bit too British for
Sounds a bit
that.
old-fashioned as well.
Mhm. Yeah. Um, who used to come Monday, Tuesday, Thursday, Friday.
Okay.
And she would come and clean. And I used to teach online at the time. So she would help my daughter, like if she woke up when I was teaching. So I used to plan my teaching around when she was asleep. But she would be there in case she woke up and like she'd help cook and things like that, right? Because again, living in third world country, you have other challenges like electricity and water isn't always there,
Mm.
right? Um, to very extremes of, you get 3 hours of power every couple of days.
Okay.
Mm. So we ended up putting in a generator just to make sure we had light at all times, make sure everything was clean. We put in an extra water tank to make sure we always had water. All of those things, which we wouldn't have had to think about if we went to the UK, right? But let's remember that even up to now, maybe she wouldn't have had anything done. So I still stick by my decision.
Yes.
But anyway, so we said, no, let's always have somebody in the house and somebody that would come with me because was still taking her to all of her baby classes. She had a music class, a 1-year-old music class where they used to go and like things around, and she used to go to Jolly Tots, so they used to waddle around to music and walk over some little things, sensory play stuff, and that type of stuff. I'm like, she still needs to do that. I still need her to do that. I still need to be around mothers. But it just always meant I had like somebody with me to help in that case,
Yeah.
which I didn't feel that was fair on our house help because she didn't sign up for that job, right? Even though that woman is precious. She came to the hospital. She sat in the room for hours and hours. She did help me drain bags.
Wow.
She did help me calm Naleli. She helped me do so many things that was so above and beyond. But she was like, Madam, I've watched this child since she was born.
Yeah.
Like, she's my child too, you know?
Yeah.
Um,
Yeah, I get
but
what you mean.
I didn't feel like it was fair on her at the time. So we had my sister-in-law's friend that came. So she was there, was able to drain a bag, and I was confident that she's able to drain a bag. But whether it was fortunate or unfortunate, she never had a bag leak unless I was around.
Oh, isn't that always the case?
Right? So she never had to change a bag. So and then I was like, do you know what? Realistically now, do I need help? Because I was still changing a bag leak by myself because it always used to happen after she'd left and my husband was on his way home. Oh no, you can go, he's just down the road. And then there's poo everywhere because she's had a bag leak.
Yeah.
So no, I even managed to end up changing up by myself, a full bag change by myself at when she was like 16, 17 months wanting everything. And we used to say she had an emotional support spray because she just hold on to the spray bottle of the spray we used to put around the stroller. And she just put the lid on, pull the lid off, on, off, on, off, on, off. And that saved me a lot. And I just
Yeah.
throw it a bit of gauze, throw it a wet wipe, throw it a nappy as I'm like trying to do this thing. But I'd always, set up, you had your routine, you knew this had to go first, and then this, and then this, and then that. Um, and then, some days I'd be like, "Do you know what? Have a little run around the house a minute."
Yeah.
Right? It's all right. Go on. Have a little run around the house a minute. Chuck a bit of gauze on her, off she goes, that type of thing. Chuck a bit of gauze in the nappy, give her 10 minutes, she's due to go in the bath or whatever. Um, but that was something that terrified me was a bath.
Okay.
Uh, Mainly because it took us so long to get a bag on her. It was almost a month to get a bag on her. And I know these bags are designed to be able to get wet and all that sort of stuff. But the thought of having to change a bag because we'd got it wet rather than because it needed changing, I was like, I'd rather sponge bath her.
Yeah.
I'd rather just sponge bath her. So we should just sit her in the bath and then put water around her and clean her as much as possible in that sense. And that was difficult because she's a child that loves water. But it was just something I was terrified of. And my friend, the one with the son who also had the stoma, she said to me, Jess, put it in the bath. I'll come and put it in for you. And I'm like, I can't. It's just the one thing I can't do. I just can't. And it was fine. She was clean, right? The stoma was clean. She was clean. She didn't need to have the bath. But it was one thing I really couldn't get past. But anyway, so the dilatation started, and the friend, my sister-in-law's friend came, but then unfortunately her son wasn't well a couple of times, and I just couldn't risk my daughter having a cold and flu. She didn't need any more stress on her, you know? And it got to the point where I was like, do you know what? I can do this. It's fine. I'm just gonna do it by myself. I went to places I was familiar with. You know, I never took her to the supermarket. I never took her to places where if she needed a change of a bag, I wouldn't be able to do it there and then.
Yeah.
Right? I took her to friends' houses. I took her to the same play group where everybody knew what was going on and would be like, do you want a hand? Do you want to sit down and we'll have her for 5 minutes? Do you want to go and run an errand? You know, that type of thing. We had an amazing support system there. My one friend set up a food drive that sent food to the hospital for us every day. They sent food home for us for the first month after every surgery. Um, like they were amazing. But back to the NGO, he kept us in flux of everything that we needed. Anytime we needed it, bags, sprays, whatever he had, he gave us for nothing,
Wow.
right?
Incredible.
Because it's a charity, right?
Yeah, yeah, yeah.
Ask for money. They can ask for donations, but
Yeah.
they can't charge you for something realistically, right? Because they can't make profit.
No.
Um, or any profit that is there goes back into the charity bank account to do
Yeah,
more,
yeah. The bottom
right?
line has to be zero, effectively.
Charity. Yeah, exactly. So I am quite a sociable person, quite a talkative person, if you hadn't noticed. Um, and I said to my husband, we got to do more. We can't just give them something and walk away from this. We can't. So I used my daughter's story to make people feel sorry for people with traumas. I did. Because at the end of the day, people care more when it's a child.
You
They
got,
just
yeah,
do.
yeah.
They just do. So no, I didn't use her. It was her situation at the time. It was the complete truth, but it made people think.
Hmm.
And I did a family fun day event, which should have been before she had a reversal, but because of the dilatations that we weren't told about, um, and things didn't progress as quickly as it should have. Unfortunately, she was still in hospital after the reversal when the event happened. But my husband was like, "Go! You've done all this work. You got to go." But yes, set up the family fun day event with like bouncy castle, soft play, a food market, like food trucks, and I did a raffle. So I sold the raffle tickets at 50 kwacha a ticket, which is like just over £1. But used contacts such as Radisson Blue gave us a free night stay. The Radisson Blue Hotel in Sac gave us a free night stay. They gave us two adult free buffet. They do a buffet on a Friday night, a game buffet. There's a safari lodge, like a resort thing, just outside of the capital. Gave us a weekend for a family of four and a day visit for a family of four. We had a piece of jewelry from a jewels, which is called Jewels of Africa, which is like the main jeweler in Zambia, basically.
Okay.
We had over 50 prizes from something like a car wash to a Radisson Blue stay. We had like $150 photography family photo shoot. We had massages, gift vouchers for like restaurants and random stuff, but like so many people got on board. And then we also had just private donations. A colleague of my husband's just gave 5,000 kwacha, which is like 200 and something pound, um, which is like almost a nurse's salary, you know.
Yeah.
Uh, there's there were a local bar that I frequent before. Um, the manager was like, "Oh, let me see what I can do for you." Spoke to the owner. The owner sent 5,000 kwacha.
Wow.
Yeah, we had a
Amazing.
lot of just donations. We had things. So I did the raffle tickets. I did 50 kwacha one, 100 kwacha for three. So more people would buy three than one, right?
Yeah, of course they will. Yeah.
Um, which was really good. So overall, I raised almost 3 grand
Wow.
um, for this charity. And actually, they had a container of supplies that was on its way, and they didn't have the money to clear it at the border, but then they did.
Oh, that's
So
brilliant.
they used that money to get that container across the border and now are distributing that throughout of Zambia. Because you've got people that can't even have access to like another country, never
Yeah.
mind even getting something from there,
Yeah.
where they'll just use like plastic bags.
Yeah. But you know
They'll use
exactly
a bit of
where
cloth,
that money's
but
gone.
use a bit of cloth,
Yeah. Yeah.
right? People then smell, people get infections, people,
Mhm.
taboo things still. And actually, the I got the surgeons on board. I got surgeons to give donations and buy raffle tickets.
Wow.
Uh, right? Because they also didn't know this NGO existed. That can help so many people for them.
Of course it can.
Um, and the NGO, what they're also trying to do is set up trainings for nurses so they can be stoma trained,
Mm.
so that every ward of every government facility can have at least one nurse on shift that knows how to change a bag,
Yeah.
right? We
It's
don't have
vital.
that right now.
Vital.
Every single time we were on that pediatric surgical ward, there was at least two people with a stroma. At least, right? I personally put a bag on a girl's stoma. She didn't have Hirschsprung's, but she had a double barrel stoma, which was a bit all over the place actually. She had a lot of surgeries, a lot going on. And she was 17, but she was like 5 stone soaking wet. Um, and didn't speak a lick of English, only spoke local language. And I was there putting Sudocrem and some stoma powder in the bag on her and just gave her everything I had at the time.
Mm.
And the mother just looked at me and was like, "What's that?" So I had to get the surgeon back in and was like, "Can you translate of like
Yeah.
every time now that there's something in there?" And she had ileostomy as well. I'm like, "You just open this and drain it. And then if you have any sort of leak out of the bag, that's when you have to change the bag." And she's still looking at me like she got two heads. So like talked her through like, "No, this is the size. Now I've already cut one for you. Keep this little bit, put it on the other one, draw a line, cut around that one, like use the stencil forever and whatever." And the surgeon just looked at me and was like, "Yeah, you're doing things I could never." Like she just didn't have the time to,
No. No, that's what we
right?
said before, isn't it?
And that was like the number two surgeon actually from like the main one. My daughter had three surgeons altogether. Um, the main one and then two that assisted. Um, but no, without that NGO, we wouldn't have had all the supplies that we needed.
No.
Um, and the final thing that actually worked for her, the cream, was a coloplast cream. But it was hydro something wound cream. So it wasn't a specific stoma cream,
Hmm.
but because of how bad the excoriation was, she needed it.
Yeah.
Um, and that was that. We did have leaks, and you're like, "Oh my God, the skin is red. Oh my God, the skin is red." And then you're like, "Okay, give her 5, 10 minutes where we leave the bag off. Sing to her while she's standing there and she's on the changing mat. Give her 10 minutes, just let her breathe and then put it on." We had leaks in the night. You're like, "Oh, for God's sake. Why at this time? Couldn't have been 2 in the afternoon instead of 2 in the night? Can you not?" And she's a really good sleeper, always has been, and she was a trooper, absolute trooper, through it all. But you know, I still don't feel like I would be prepared to do it again, even though I went through it all. Because it's not going to be the same, is it? Right? It's
No,
not. No stoma
no.
journey is the same. But thankfully, she had her reversal on the 12th of August. We were discharged on the 19th, and we were just no, 20th, the Tuesday. We were discharged on the Monday afternoon. We had to wait for the surgeon to come down from her elective surgeries on the Monday morning. And we were discharged on the Monday afternoon because my daughter actually dragged her bag outside the door into the corridor and was going home, home, home. She was only 18 months, but I think
Bless
she'd
her.
hear my husband's talk so much of like, I just want to go home, I just want to go home, I just want to go home. That she was like, home, 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 home. Um, and the surgeon came down, and my husband's actually taken a walk with her, with my daughter outside because she was nuts at this point. You know, she wants to go. She's an 18-month-old baby
Yeah.
wandering around. She doesn't want to be stuck in a room, does she? Um, and she came in and she was like, "Where's she?" I was like, "Look through the window. She's running up and down the car park." She's like, "Yeah, let me go and fill in the forms. You're going home." And I'm
Yeah.
like, "See, fine." And she
It
said, "You know
worked.
what? This is why I'm a pediatric surgeon because babies don't bullshit." Like, you know, a child, if they're feeling unwell or not. You know
Of
if they're
course you do.
feeling good or not.
Yeah.
Adults sometimes feel sorry for themselves. And adults sometimes are too bloody stubborn.
They can be either way.
Right? So she's like, this is why I'm a ped surgeon. But we had to continue the dilatations. And we continued for a couple of weeks. And then, no, about a week. And I was worried that, no, the stool at that time was still very, very soft, right? But I was really worried about, her getting backed up and putting pressure on the where they'd done the reversal. And like the last thing we need is that being bloody septic because of this or whatever. And the surgeon was also not concerned, but made it known that that would be a possibility if we can't get the stool to be passing and stuff, right?
Yeah.
So the surgeon then was like, do you know what? If you're happy for it, bring her to the hospital as many times in a week you want, and we will do at least one a day. And then you do the evening. You do the morning, we do the evening.
Okay.
That's sorry, other way around. We do the morning, you do the evening. So we took her 3 times a week for a little while, and then I was like, "Do you know what? I'm doing it myself. She's pooing. I hate it. She hates it. My husband hates it. But there's light. There's light somewhere. And we went from here to here.
Hmm.
Sorry, other way around. From here
Yeah, 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 I
to
was
here.
thinking that.
Sorry, wrong round. And everything was okay. We had to follow a diet of, softer foods, don't give her too many harder foods and all that sort of stuff. But all we knew was a high fiber diet, right? That's all we knew.
Yeah, of
So
course.
that's the food she ate anyway. And she was quite fussy, and it was one of those things where we were like, oh, maybe she can have a reversal now. She should never be fussy again. Maybe she was fussy because she was always full and she was only ever having the same foods and blah, 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 blah. Which now she is actually a lot better. The amount of Chinese food she's eating now is just wild. Um, but she's still quite particular with certain things. She'll look at something and be like, hell no. But you hide it in something, she'll eat it.
Fair enough.
So, she's
Like a
had a
lot of
lot of
children.
different food things go on. So, it's going to take us some time. But unfortunately, we had to deal with excoriation on the other end,
Mm.
literally. She had horrific nappy rash. It wasn't rash. It was burns. It was excoriation, right? And it was one of those things where people would say, "Oh, just leave a nappy off her." My girl got cheeks.
Mm.
Right? Doesn't matter whether she got a nappy on or not. It takes some time to come out. It was still going to smudge. She was still having that acidity of the poo that she wasn't used to rub on the skin. Whether that was for a second or for 10 minutes, it was still happening. And the amount of times where I lay on the bed with her on her front, with her wide open, trying to make her just lie there to have some air and, like it just wasn't going to work. She's an 18-month-old baby. Um, and it'd get better. There was a cream we were using, it got better, and then suddenly it got worse again. And then it got better, and then it got worse. And we tried so many things. And then eventually We had a storm nurse in the UK that suggested a study that she had found from an Australian pediatric study of post-stomas, which was a certain type of stoma powder. I want to say it starts with an O. It's in a drawer here somewhere. It starts with an O. But mixed with pseudocream, half and half, pre-mixed.
Okay.
So we did a lot of throwing on the cream, throwing on the powder, throwing on the cream, throwing on the powder. But actually, if you pre-mix, makes a huge difference.
Hmm. Didn't know
So
that.
it was a pseudocream powder mix
Hmm.
put, right? And if I say that worked like magic,
Brilliant.
it worked like magic. We would have the odd day where it'd stop working and the skin would open again. Maybe if she just went a bit more often. Um, Maybe if she did have a bit more harder food because she wasn't eating anything, so you gave her a pack of Wotsits type thing. Because you're like, well, she got to eat. If she's not
Yeah.
eating, she needs to eat. Um, and then it would have a bit of a knock-on effect. That she was having pebbles then rather than a bigger poo, so she'd go more often. So then they'd be more acid, that type of thing. Um, but somehow, some miracle, I don't know, the start of February this year, so 6 months later, it just stopped. And she never had a rash. She was never red. All of the spots now, which are like dark spots that are where the skin healed, are now just like beauty spots. They've faded away.
Hmm.
She is currently in the middle, sort of, toilet training because she's in full-time kindergarten here. So she's there 8 till 4.
Right.
And sleeps in school as well. They have a nap in the middle of the day. And all of her little friends are going to the toilet. So she's like, oh, let me go. But then in the house, she doesn't want to go to the toilet because she's like, I wear a nappy in the house. So we're not pushing it at the minute. I don't think she is fully ready, and we're about to have a summer holiday and whatnot. So I'm like, I don't want to be peed or pooed on the plane, thank you. So I'm gonna wait until we get back and then push it a bit, see is she ready? But she is still a bit unpredictable. She's not regular with her toilet in. She does go more in the afternoon, evening than she does in the morning because obviously she goes through the night and the morning and then, you know. But she'll go some days, she goes once, she goes some days, she doesn't go at all. She goes some days, she goes 5, 6 times in 3 hours,
Yeah.
right? She does not have a regular pattern. We just need her to know when she's going for us to be able to then toilet train her.
Yeah.
And I know it is one of those drawbacks of after a stoma and after Hirschsprung's, all that sort of stuff of delayed toilet training. And I don't care how long it takes her. Like, it is what it is. Um, as long as she's comfortable and as long as she's not getting any sort of rash and whatever again. Because that was another reason, I'm like, get it out of nappies, I'll help with the rash, surely. But actually, we realised no, I wouldn't, because if she's still going to pull herself, she's going to pull herself, right? Um, but now she'll tell you, oh, like she'll stand there and go, poopy. And you're like, oh, could you said that like 30 seconds before so we could put you on potty or on the toilet? But consistency has changed even in the last like week or so. Um, now we're almost, we're 10 months post reversal now. And she does seem to be having more slugs now,
Right.
should I
Yeah.
say? Um, and you can see the consistency is changing and all of that sort of stuff. So I do feel like, we're still not at the end of the road. But she is now 10 kilos. She's in double digits.
Excellent.
And she was in the sevens during all of the surgeries. And we got her, I think she was like 8.2, 8.3 when we left Zambia in February. And now she's 10. So Chinese food's definitely doing her good.
Yeah.
And like she's eating a lot of meat now as she was a bit veggie before in a way. I don't know whether it was just I got no idea why, but now she is eating a bit more meat. She's drinking a lot more water. She needs that, and she's in a routine because of being in school as well, you know. She has breakfast at home, and then she has their morning snack, then they have lunch, then they have their afternoon snack, and she comes home and has dinner. So like she is in more of a routine, and Chinese are very health conscious, especially for babies, as well, and with digestive health. Never let anybody drink cold water. God forbid you drink a cold drink, your digestive system goes into shock.
Oh, really?
Um, Actually, that is quite true. A warmer drink is better for your digestive system than a cold drink.
Didn't know that.
Yeah, so they drink warm water. They don't drink cold water. I could never because it makes me think I'm drinking bath water, to be honest with
Yeah,
you.
yeah. Just
Not for me. I don't even drink tea or coffee either. I'm not a hot drinker at all. But for her, she'll happily drink warm water, which is great because that
yeah,
helps her.
fantastic.
It really does help her, which is fab. Um, so yeah, that's pretty much the story. So yeah, not a textbook case. She was fine until she was 7 months. Constipation here and there, and then positive hair sprungs.
Fantastic. Well, thank you so much for
Yeah.
sharing. And just before we wrap up, I know you've mentioned a little bit about what you hope and expect for the next few months for her socially,
Mm.
but medically, where are we sort of in the near future?
So, medically, we are a WhatsApp message away from the surgeon.
Okay,
She does send a message every now and again, how's things going? I sent her an update and a couple of pictures and stuff the other day, just being like, this is what's going on. And she's like, keep going as you're going. She's like, whenever you're in Zambia, I'll see you.
amazing.
Um, for right now, I don't feel like there's any complaints. She's not in any sort of pain. Um, there's not many days where she doesn't go, you know. Um, I think we went once, she hadn't gone for 2 days, and I was like, if we hit day three, I'm gonna have to message the surgeon.
Yeah,
But actually, it was just one of those things.
yeah,
And then she went, she was fine, and everything's okay. And she was still eating, and she was still drinking, and she was fine. She didn't have a temperature, all that stuff. Um, so yeah, medically, it's the surgeon will see us whenever we are within country, and we are just a WhatsApp message away if needs be. Which I know probably isn't a thing in the UK either.
not as
Um,
such, not
I'm
as
sure you've got
such.
those doctors that will do their absolute best,
Yeah, sure.
but they are run off their feet, right?
Of course,
Um,
yeah. It's
so
not a blame thing on anybody's part. It's just the situation is the way it is at the moment. I believe
exactly,
that's
exactly. So yeah,
just
I
the way
would
it
say
is.
medically that's where we are. We know we gotta just keep her growing. And that's we are now in 12 to 18 month clause officially, with some 18 to 24. She is on the right track with that. But as I said, she was never going to be 6'2". Like she was always going to be a bit petite. She's got the tiniest feet. Like she's a size 3, 4, where she should be like a 6, 7. Like all of those things. She's got like these tiny feet. And she is on the smaller side, but she's healthy now.
That's the
She
main thing.
doesn't have any medical reason of why she's small now. You know, that's
That's
the
brilliant.
that's the thing. So yeah,
Fantastic. Well, thank you so much for doing this because I know it's getting on quite late where you
yeah.
are. Um, but again,
Sorry,
I
Friday tomorrow.
oh, fantastic. I'll obviously end on this and just sort of wish you, your family, and your daughter, all the very, very best for the
Yeah,
future, and hopefully keep gaining weight, keep cracking on with everything because, yeah, she's been through an awful lot. So I really,
she
really wish
has. She has,
wish
and
the
it was
best.
again one of the decisions that we made to do it rather than wait and see what happens, or wait for a referral and blah blah blah. Was more medically, of course, it was on her. Her body went through so much, and I'm sure in her little brain, whatever was going on. But she's never going to remember any of this. She's got her scars, but they're also already fading and changing. And like, if she asks us one day of like, what was this? Of course, we'll tell her what she went through. She needs to know what she went through. Can't hide that from her. And also, why should you hide it from us? Nothing to be ashamed of. And also, she could be in school and somebody's got a colostomy bag,
Exactly.
right? She could be their friend and say, "Oh, I had that once."
Yeah.
Like
Yeah.
there's all of these things that you just don't know what will happen in the future. And it's another reason, selfishly, of why we helped the NGO the way we did. I don't know. I want to have a stoma one day,
Never know.
right?
Never know.
Not open for it.
No, no, no. I'm not wishing it on you.
No, yeah, that's what I mean. You're not hoping for it. You're not putting it out there, but
No.
you don't know. You don't know if
Exactly.
your partner, your husband, your wife, your child, your brother, your sister, next door neighbor, you don't know.
Mm.
So, support these things, even if it doesn't directly affect you right now, And I know it's easier said than done. You can't help everyone. You can't. There's too much
No.
shit for that. But it is one of those things that once it is in your vicinity, try and help that community. And that was why I wanted to do this to say, look, it's not all just this way it happens. And if you think your child has a problem, keep going with it. Keep going back every month. Keep going back when you think, do you know what? No, this isn't right. That mother's instinct is a thing,
Yeah.
right? Parent instinct is a thing.
Yeah.
And even for yourself, your own health, nobody knows your body the way you do. So
Yeah.
even if you're listening to this now and you're like a 40-year-old and you think, do you know what? I've had problems all my life, Putin. Should I go and see someone?
Yeah.
You know?
Yeah,
Uh,
you do never know. I mean, and people always, they say to me, "Oh, you're always diagnosed in the first few weeks, aren't you?" And I'm like, "Well, no. I mean, I had somebody on who was diagnosed at 19 years old, so everybody is different, and I'd echo that and always advocate for mother's instinct. I mean, it saved my life, so it's something I will forever um, advocate for because I think
mhm.
that's so important.
Yeah, of course. Yeah.
But no, thank you so much for coming on. Um,
Welcome.
and as I said, I wish you the very best for the future.
Thank you.